Planet Vero Radio. I am Cindy Schwartz, and this show is called Patient Partners. And I am one of the featured co-host of the show, and I also have a friend of mine on the phone, and her name is Jeannie Roller. She is in Indiana, and she is one of my patient partners, and we are going to take the time, we have about 10 minutes to talk, to explain what exactly we feel patient partners are and what we can do to help each other when we have to navigate the medical system and we're afraid. We're up against some disease, some diagnosis that we really don't understand. We try to ask the best questions that we can. We really don't know what those questions are. We are told, ask as many questions as you want, but the appointments last 5-10 minutes, maybe if you're lucky, a little bit longer from what my recent experience is. And people are just kind of left with, what do I do? I really don't know how to make that decision. Do I get a second opinion? Do I talk to another doctor? And then we've both found ourselves, both Jeannie and I, in situations where we really didn't have enough information. We were in serious situations. We didn't know who to ask. We trusted what we were being told because it's the medical community. It's a doctor that's telling you, very educated people. And personally, myself, I hadn't been really seriously in the medical situation for quite a few years, and it had changed a lot, and I was shocked. And then, as it turned out, never really got the information I needed. Don't, to this day, know if I made the right choice with the surgery I chose, and then had a lot of repercussions, a lot of trauma, a lot of anxiety, and PTSD and bad things that happened to me, and am still left with that and have decided to, as Jeannie Roller has, to try to help people not have to go through that and educate them the best that we know how, and also to bring people on these 10-minute segments that have been through different scenarios and maybe what they did to change it and to help make it better for themselves. Because we want to work with the medical community. I mean, we kind of have to. You certainly can't operate it on yourself, and you don't really have the logistics to do all the testing that they have. So, Jeannie Rollo, thank you so much for joining me. You're on the phone. You're in Indiana, and let's talk about this.
Okay. Well, first of all, I wanted to expand on something you said, that we are encouraged to ask questions. Not really. They don't really want us to ask certain questions. They don't want us to know what really happens when we are going in for a procedure, because they know if they give us the true information, we may not go through with having a procedure done. So I feel a lot of people are misled. Informed consent is supposed to be the law, but they have been able to finagle it to make it that informed consent is only what they want us to be informed about, and not some of the things that we really do need to be informed about, like, are we going to be exposed during surgery? Who is actually doing our surgery? Who all is in there? And what are their qualifications? In no other aspect of our lives do we so blindly trust in anyone providing services for us.
Mm-hmm. That is true. That is true. And we have all of our lives been led to believe that we're hearing the truth.
Yes. Yes, and we're not. I mean, medical people have a code of silence where they are silent when they witness something being done wrong, and once it's brought up, then they circle the wagons and they protect the person who's doing the harm. It is horrible as a patient who has been harmed to try to go through the process, and I'm not talking just about getting monetary gain, because for most of us harmed patients, that's not our purpose. Our purpose is to find out why we were harmed and to prevent it from happening again. So there is no recourse for harmed patients, really. Malpractice cases rarely happen. Most people never get an attorney to represent them. That's the sad, hard fact.
And I want to interject, too, a lot of people that I've talked with, and I will have some of them on these 10-minute segments, don't want to sue. We don't necessarily, I mean, I don't want to sue. I just want answers, and I want it to change, because I don't want to know that someone else having the same surgery I had with the same surgeon that I had in the same hospital, same facility, is going to go through what I went through. It's just horrifying.
It is. Once you become an abused patient, you can't undo it.
No, and you can't. Mm-hmm.
So that's what we want. We want to change it so no one else has to have happened to them what happened to my husband. And I'm sure, as you said, you feel the same way.
I do feel the same way. So one of the things that I reached out to, because I was just so devastated, I when it happened to me, I just couldn't believe that medical people treated a patient like this. And and what I'm talking about is basically I was a date of birth and an insurance policy. I talked with the surgeon literally, and it's time-stamped on the records, and we can talk about that on another show, that I literally talked with him for maybe 10 minutes for a serious operation, and he said then, sitting there, to give, due respect, do you have any more questions? Well, sitting there, I didn't. I didn't really know what questions I had to begin with because it was all just, and that's why it happens with a lot of people, it's just told to you. And you have to kind of, think about it for a little while, and then you'll have the questions. Well, I myself personally never got any more appointments to talk with him about it. So I learned a lot. And one of the people that I reached out and I found on the internet is a lady named Misty Roberts. She is deaf, and she also started a corporation, or a 501c3 corporation called Medical Patient Modesty. Her website is patientmodesty.org, and she is also on Facebook under Medical Patient Modesty, and she helped me tremendously because Misty's been dealing with this for, I'd say, at least 15 years. And so
she is fantastic.
She is fantastic, and she has other people that work with her, Robin Leonard, who is in the Dignity program, and a lot of this is about dignity and patient respect, and like you said, Jeannie, it is about honoring patient rights, that we actually do have rights and we actually should be informed and consent to what we're being informed to.
And actually, we are covered under basic human rights. No one should have anything done to them without their consent. No one should be treated in an inhumane manner. That's basic human rights. And many times hospitalized patients are not given any human rights.
Or they're disregarded. And another thing and another thing, so it says it on the paperwork, and we've both found that once you sign that paper, that's really all that's required. I mean, of their side, that's it. You sign the paper. If you're coherent, if you're not, if you're drugged, that's for another show too. It's signed. Legally, it's signed. Whether you understand it or not.
Well, and in my husband's case, there was nothing signed, so he never signed anything. So he was never given the opportunity to ask questions. So what do you find? Yeah, it's horrible. It's horrible. And so the recourse with that is, from what I've been told, is, well, it must have been an emergency situation, and all bets are off when it's an emergency situation. So we have like a minute and a half left, Jeannie. What have you found to help yourself to try to move forward with this? To tell people maybe this will work for you? I have started on Twitter. I'm at Rights for Patients. I have put out educational tweets for people to educate them, to bring attention to medical harm. I have Facebook, Patient Rights for Patients also. I am going to be writing a book, and I'm also going to be giving you material for your book. I want to start a website for information for patient rights, because I really don't believe people are aware that they have rights. I really don't believe it.
Well, the sad part is, I don't want to say hindsight, but when it happens to you, then you realize that you didn't know. That's what happened to me. That's what happened to my instance. So we have a couple of seconds left. I am going to sign out with saying this is a show called Patient Partners. We're trying to partner to help people, to educate them, to find out what we found out, and maybe help somebody along the way. Medical Patient Modesty certainly will take any question that you have and answer that, and that's at patientmodesty.org, and also Medical Patient Modesty on Facebook, and I am on Twitter at Trauma PTSD.